Hello and welcome to Wise Elder Voices, where the wisdom of age meets critical health insights to guide you toward a safer life. I'm your host, bringing you advice rooted in years of experience, here to help you navigate the challenges of aging. Today, we're addressing a vital topic that could save your life. Doctors warn 6 deadly symptoms you should never ignore after 60. As we age, our bodies send signals that demand attention, and ignoring them can have fatal consequences. From heart attacks to strokes, these symptoms are red flags you can't afford to miss. Backed by medical experts, we'll uncover 6 warning signs and what to do about them. Whether you're over 60 or caring for someone who is, this video is for you. So, listen closely and let's learn how to protect your health before it's too late. Let's get started. Life after 60 can be filled with joy, but it also comes with health risks that demand your attention. The first deadly symptom you should never ignore is chest pain or discomfort. This could be a sign of a heart attack, one of the leading causes of death among seniors, and it's a signal you can't brush off. Picture this: a sudden crushing pain or pressure in the center or left side of your chest, lasting more than a few minutes or coming and going like a persistent ache. It might feel like someone's sitting on your chest, making it hard to breathe or move. The National Institute on Aging warns that this isn't just indigestion, it could indicate your heart isn't getting enough oxygen, a condition that can turn deadly fast. For seniors over 60, chest pain can vary. Men might feel the classic heavy pressure, while women are more likely to experience subtle signs like tightness or a burning sensation, often mistaken for heartburn. Other clues include pain radiating to your shoulders, arms, neck, jaw, or back, or a sense of impending doom that you can't shake. The CDC emphasizes that heart attacks in older adults can be silent or atypical, so any unusual discomfort warrants immediate action. Ignoring it could lead to irreversible heart damage or sudden death, especially if arteries are blocked. Let's meet James, a 63-year-old who learned this the hard way. "I felt a dull ache in my chest one afternoon," he recalls, "but I thought it was gas and waited it out. Hours later, I collapsed. Turns out it was a heart attack. I was lucky to survive." James's story underscores the danger of delay. Doctors urge that if chest pain lasts more than 5 minutes, call emergency services immediately. Don't drive yourself. Time is muscle, and every second counts. Keep aspirin nearby if advised by your doctor, but only take it under guidance. This symptom isn't just about pain, it's a wake-up call to prioritize your heart. Aging thickens arteries and raises heart disease risk, making early detection critical. Monitor your blood pressure and cholesterol, and exercise regularly, but don't dismiss discomfort. If you feel it, act fast. Your life depends on it. Imagine the relief of catching it in time, sparing your family the grief of loss. This is your first line of defense after 60. Listen to your body and seek help without hesitation. As we age beyond 60, our bodies change, and one symptom that demands your attention is shortness of breath. This isn't just about feeling winded after climbing stairs. It could signal a life-threatening condition like a heart attack, stroke, or pneumonia, all of which can strike seniors with deadly force. Picture struggling to catch your breath during a casual walk, feeling like the air won't fill your lungs, or waking up gasping in the night. The National Institute on Aging notes that this can be an early sign of a partial or complete blockage of an artery to the heart, cutting off vital oxygen supply, or it might indicate lung issues like pneumonia, which can escalate rapidly in older adults. For seniors, shortness of breath can be deceptive. It might come with chest discomfort, fatigue, or even no obvious cause, making it easy to overlook. Women, in particular, may experience this without the classic chest pain, according to health experts, while men might notice it alongside sweating or nausea. The CDC highlights that this symptom, when sudden or persistent, could point to a pulmonary embolism, a blood clot in the lungs that's fatal if untreated. Ignoring it risks irreversible damage or death, especially since seniors' lungs and hearts are less resilient. Meet Ellen, a 66-year-old who ignored this warning. "I thought it was just getting old," she says. But one day I couldn't breathe properly and collapsed. It was pneumonia that nearly killed me. Ellen's delay nearly cost her life. Doctors say prompt action saved her. If you experience shortness of breath, especially with dizziness or chest pain, call for help immediately. Sit down, stay calm, and avoid exertion until medical aid arrives. Oxygen therapy or medication can be life-saving if caught early. This symptom is a red flag you can't ignore after 60. Aging weakens respiratory muscles and heart function, increasing vulnerability. Regular checkups and avoiding smoking can help, but listen to your body. If breathing feels off, don't wait, act. Imagine the peace of mind knowing you've caught a deadly condition in time, protecting your years ahead. This is your second critical alert. Prioritize your breath and seek care without delay. Another deadly symptom you should never ignore after 60 is unexplained bleeding. This can be a silent harbinger of serious conditions like internal hemorrhages, gastrointestinal issues, or even cancer. And for seniors, it can escalate quickly to a fatal outcome. Picture noticing blood in your stool, urine, or vomit, or experiencing unexpected nosebleeds or bruising that doesn't heal. Healthline warns that postmenopausal bleeding in women can signal gynecological cancers, while blood in the stool might indicate colorectal cancer, a leading cause among older adults. This isn't a minor issue to brush off as a one-time event. For seniors over 60, bleeding can be more dangerous due to thinner blood vessels, medication side effects like blood thinners, or underlying conditions like ulcers. The CDC notes that sudden or repeated bleeding, especially without injury, could point to a ruptured blood vessel or organ damage, which can lead to shock or death if untreated. Men might notice blood in urine as a prostate issue, while women could face vaginal bleeding post-menopause, a red flag for endometrial cancer. Ignoring it risks missing a critical diagnosis that could cost your life. Consider Tom, a 70-year-old who dismissed blood in his stool. I thought it was hemorrhoids, he says, but it turned out to be colon cancer. I waited too long, and it had spread. Tom's delay led to aggressive treatment, but early action could have changed his outcome. Doctors urge immediate medical evaluation if bleeding persists beyond a day or appears without cause. Keep a record of when it happens and how much, and don't self-medicate. Seek a professional to pinpoint the cause. This symptom is a wake-up call after 60. Aging increases cancer and bleeding risks, so routine screenings are vital. If you see blood where it shouldn't be, act fast. Your life hangs in the balance. Imagine the relief of catching it early, sparing yourself and your loved ones from a tragic loss. This is your third critical sign. Don't ignore the bleed. As we move past 60, our minds may slow, but sudden memory loss or confusion is a deadly symptom you should never overlook. This could signal a stroke, dementia, or a severe infection like meningitis, each capable of claiming lives if ignored. Picture forgetting recent events, like what you ate for breakfast, or becoming disoriented in familiar places, like your own home, with no clear reason. The National Institute on Aging warns that abrupt changes in memory or sudden confusion, especially with difficulty speaking or moving, could indicate a stroke where brain cells die from lack of blood flow, a medical emergency. For seniors, this symptom can be tricky. AARP notes that while mild forgetfulness is normal, sudden lapses, such as not recognizing family or struggling with basic tasks, demand attention. Women might experience confusion with stroke symptoms like headache or nausea, while men might notice it with weakness. The CDC highlights that infections or low blood sugar can also cause this, potentially leading to coma or death if untreated. Ignoring it risks permanent brain damage or fatality, especially since aging heightens stroke and dementia risks. Meet Margaret, a 64-year-old who ignored this sign. I forgot where I parked my car and felt foggy, she recalls. I waited, and it was a mini-stroke. Doctor said I was lucky. Margaret's delay could have been fatal. If confusion hits suddenly, call emergency services. Stay with someone, hydrate, and avoid driving. Early intervention with medication or therapy can save your life. This symptom is a red flag after 60. Aging affects brain health, so monitor memory closely. Regular cognitive exercises and doctor visits help, but act instantly if confusion strikes. Imagine the relief of timely help, preserving your mind and years. This is your fourth critical alert. Don't let it fade. Another deadly symptom to watch for after 60 is a persistent fever or chills, which could indicate a serious infection like pneumonia or sepsis, conditions that can turn fatal in seniors. Picture a fever that lingers above 100.4 degrees Fahrenheit for more than 2 days, accompanied by uncontrollable shivering or sweats that soak your clothes, even in a warm room. West Hartford Health and Rehabilitation Center warns that pneumonia, a top killer of the elderly, often presents with fever and chills, progressing to breathing difficulty if untreated, especially in those with weakened immune systems. For seniors over 60, fever can be subtle or masked by other symptoms like fatigue or confusion, making it easy to miss. The CDC notes that sepsis, a body-wide infection response, starts with fever and can lead to organ failure or death within hours if not addressed. Older adults are at higher risk due to slower immune responses and chronic conditions. Ignoring it risks rapid deterioration, with mortality rates soaring without prompt care. Meet Robert, a 69-year-old who brushed off his fever. "I thought it was a cold," he says, "but it was pneumonia that landed me in ICU." Robert survived, but doctors say early action was key. If fever persists or chills worsen, seek medical help immediately. Rest, hydrate, and avoid self-medicating. Antibiotics or oxygen can be life-saving if caught early. This symptom is a red flag after 60. Aging weakens immunity, so monitor temperature daily. Vaccinations and hygiene help, but don't delay if fever strikes. Imagine the relief of timely treatment, saving your life. This is your fifth critical sign. Act now. The final deadly symptom you should never ignore after 60 is extreme fatigue or weakness, a silent sign that could point to heart failure, anemia, or cancer, conditions that can be fatal if overlooked. Picture feeling utterly drained despite rest, struggling to climb stairs or needing to sit after minimal effort, as if your energy has vanished overnight. Healthline warns that this could indicate heart failure, where your heart can't pump blood effectively, or anemia from blood loss, both common in seniors and potentially deadly without intervention. For those over 60, fatigue can be insidious. The National Institute on Aging notes it might accompany shortness of breath or pale skin, signaling low oxygen or severe illness. Cancer, like leukemia, can also cause this, draining your body's resources silently. The CDC emphasizes that sudden, unexplained weakness, especially with other symptoms, requires urgent attention, as it could lead to collapse or death if untreated. Ignoring it risks missing a diagnosis that could cost your life. Meet Doris, a 70-year-old who dismissed her exhaustion. "I thought it was age," she says, "but it was anemia from internal bleeding. I nearly didn't make it." Doris's delay was nearly fatal. If fatigue overwhelms you, see a doctor fast. Rest, eat iron-rich foods, and avoid overexertion. Blood tests or treatment can turn the tide. This symptom is a red flag after 60. Aging reduces stamina, so track energy levels. Regular checkups and diet help, but act if weakness hits. Imagine the peace of early care extending your life. This is your sixth critical alert. Don't ignore it. And there you have it. 6 deadly symptoms doctors warn you should never ignore after 60. From chest pain to extreme fatigue, recognizing these signs can save your life. If this video has empowered you with knowledge, please give it a thumbs up. It helps us reach more seniors in need. Share it with friends and family to spread this life-saving advice. Subscribe to Wise Elder Voices for more health insights, and hit the bell so you never miss an update. Stay vigilant, stay healthy. Your life is worth protecting. See you next time.